Hi, and welcome to Advanced Ethics for Counseling Professionals, brought to you by allceus.com. Ethical codes are designed to empower professionals by helping clarify ethical responsibilities. What is it that we actually really want to do and should do? Because there's a lot of different schools of thought. So ethical codes are out there to sort of streamline this process. They also are meant to identify common methods for processing ethical issues. There are a lot of different ethical decision-making protocols out there. You have to choose the one that fits best for you. But basically, most of them are starting out with identify the problem, review your codes of ethics, identify multiple solutions to the problem, evaluate how each one of those is going to impact your client, looking for the one that most closely empowers and aids your client and does no harm, make a choice, and then regularly evaluate the consequences and change up as needed. We all know that sometimes we're going to do something that has unintended consequences. So you want to make sure that you plan for those. You can kind of look and say, well, if this goes terribly wrong, this could happen. Try to avoid that. However, constant reassessment of your interventions and of your behavior will help you avoid those worst-case scenarios. And ethical codes also provides a means for correcting unethical behavior. Provides you an alternative. Well, you're doing this over here, you probably should be doing this. So when you have a professional who goes, well, I'm doing this over here and it's not right, but I don't know what else to do, ethical codes say, got a suggestion. Obviously, as we've talked about in multiple other classes, ethical codes are just that. They're pretty general codes of behavior, and you have to apply it to each individual in each unique situation, which is why it's always, always, always wonderful, recommended, imperative, whatever word you want to use, to have fellow professionals with whom you can consult. Professionals must adhere to ethics in order to maintain a practice, protect clients, and enhance the profession. Now, we've said before, and I'll say it again, laws set your minimum standard, but we want to be better than the minimum. We want to be an ethical, effective clinician. So these guidelines help us figure out how to apply the laws in a way that most effectively benefits our clients and does no harm. Introduction to ethical thinking. Okay, ordinary arguments look at clinical conclusions. If this happens, this will be the result. Moral arguments use should or ought. I should do this or I ought to do this. So clinical conclusions are often more concrete. Ordinary arguments often result in administrative decisions and include factual statement and a course of action. Moral arguments use right or wrong. Now, we're not going to do either one of these in exclusion. We need to look at what is right to do, what we should do, what's going to lead to the best clinical conclusion, and develop a course of action. So, let's do a quick ethical self-assessment. Do you live using a particular set of moral standards? I think most of us, even if we haven't sat down and written them all out, would say yes, we have a set of moral standards that say what we believe is right or wrong. And yes, there is some gray area, but generally these are the codes. Can you identify and explain those standards? Something for a lot of us to sit down and think about. Looking at issues of murder. Is murder always wrong? Are there any exceptions? Can you explain those standards? Looking at other things such as abortion, child abuse. What's right, what's wrong, and why do you feel that way? Do you assess all ethical situations by the same standards? You could, argue that each situation is unique. However, if you have a common set of standards that you adhere to, it'll give you some reference point from which to work. Now, it's important to remember when you're working with multicultural clientele, they may not share the same ethical, moral standards that you do. They may believe certain things are okay that you don't. For example, eating certain animals. Some people believe that is wrong. Some people don't. So how are you going to deal with those clients who have different points of reference and different values than you do? And do you judge yourself by one set of standards and other people by another set? It's kind of interesting when we look at professionals. If they do this, they often hold themselves to a lower standard. Well, I can do this and get away with it. But they hold other people to this higher standard up here. So they can always make sure to have somebody else to criticize to make themselves feel better. When we work with clients, especially addictions clients, it's often the opposite. They hold themselves to this standard up here that they can never achieve, so they're always beating themselves up. But they hold everybody else to this more reasonable standard. Regardless, you want to really assess if you hold two different sets of standards, why, and make sure that you're holding yourself to the highest standard. Memories are often inaccurate and influenced by expectations, desires, and emotions. So documentation is important. We want to make sure to document exactly what happened in a session, as close to the session as possible, because it's going to be more accurate. Then when you look back to evaluate whether you're behaving ethically, whether you're doing what's in the best interest of the client, you're getting what's most closest, wow, good English, closest to reality, not what you want to think or what you want to see. Facts and impressions can be greatly divergent. Remember, life is 10% reality and 90% perception. So you need to clarify with your client regularly that you are sharing both the same realities and the same perceptions about what's going on in session. Make sure to write down facts and perceptions from both you and your client. Make sure to reflect and encourage the client to reflect on perceptions of events and see if they're being clouded by irrational thoughts or anything else that may be going on in their life. When making ethical decisions, try to get a clear picture of what's going on by examining multiple perspectives. So, what would your mom say? What do you think your sister would say? What would your best friend say? If you met some guy on the street and you told him what was going on, what do you think his perception would be? Just try to examine, try to have the person put themselves in different people's shoes and pull out the common themes of the different perceptions. Get a clear picture of what's going on. And this is true for us as well as for the clients. Having faulty perceptions is just reality of being a human. So we need to make sure to constantly check in. Which takes us to critical thinking. I don't like the word critical because it sounds critical. Objective thinking guidelines. Provide objective, relevant reasons for any diagnosis or any interventions you choose to use. Why? Why should I do this? Make sure that you can back it up with information about the benefits of what could happen, the drawbacks to not engaging, or in the case of diagnosis, why do you have to diagnose me? Why do you have to give me this label? And what are the alternatives? Make sure to use good informed consent. Use reliable, verifiable data. Make sure that you can tell the client your rationale for why things are happening, but also be able to have backup data. Cognitive behavioral therapy. It works. How do we know it works? Well, let's look at some of these studies. This is verifiable data that it's been used, it's been tested, it can be effective. Reliable, verifiable data for the client. Have them keep journals or have them do score sheets. Have them use some sort of instrument like the Beck Depression Inventory in order to identify how they're progressing. That's reliable, verifiable data. They are keeping a chart of their own moods, behavior, etc. Provide evidence for the selected treatment approach. Most clients don't want to read journal articles. Most counselors don't want to read journal articles. But if they want to understand more about how it works, why it works, whatever they want to know, make sure that you know how to access that evidence. Cite information regarding how you arrived at your interpretations. In the integrated summary or when talking to your client, once you get all that information and you assimilate it and go, well, I think this may be what's going on, explain how you got to your conclusion. It demystifies the process. It teaches the client how you got to your conclusion, so maybe they can learn how to do it the next time. So it empowers them. And it also holds you accountable because you've got to sort of put little pins in the timeline going, this is how I got to my conclusion. Sometimes we jump to conclusions. This prevents you from jumping because you've got to articulate exactly how you got from point A to point B. Do allow for wiggle room in your interpretations. Again, 10% reality, 90% perception. Have some wiggle room, so if your perception's wrong, you're willing to look at alternative explanations. Take into account limitations in any treatment modality selected. Anyone you select is not going to work for everyone. So it's important to figure out who it works best for. And even if you're using it on a population for which it's supposed to work effectively, it may not work effectively for every client. So take into account certain limitations. Maybe 12-step programs work great for substance abuse, but you've got a patient who has extreme social anxiety and agoraphobia. Well, getting to meetings is going to be kind of difficult. So that's a limitation. Doesn't mean it makes it impossible to use that mode, but you've got to figure out how to deal with those unique challenges with that patient. So a criteria for a good argument. Your idea, premise, or argument must be true. You have to know that your 10% reality is true. The reasons for your argument must be relevant. Not just because I said so, or, well, there was an article in Psychology Today, or there was an article in the newspaper. You must have a logical, relevant, verifiable reason for your argument. And it must be adequately supported. Even in a peer-refereed journal, one article shouldn't be what you use to form the basis of your practice. You should make sure that whatever study it was can be replicated. There are meta-analyses. You want to let studies, have time to occur before you start just willy-nilly going, oh, that sounds cool, let me take this, and that sounds cool, let me take this. Because you take these two things that are understudied, put them together, and you may be creating a whole different monster. So let's look at this. The argument. Abstinence is a necessary goal in early recovery. Okay. 10% fact. For some people, abstinence is a necessary goal in early recovery. Does it have to be that somebody stays abstinent in early recovery? And how do you define abstinence? Just from your drug of choice? From all addictive behaviors? Ooh, that's a lot of things. How do you define it? What about the person who wants to have controlled use? Does that mean they can't be in early recovery? There aren't easy answers for this. And in substance abuse counseling, as well as many other areas of counseling, there are a lot of things like this that come up that cause clinicians to have a little friction between each other. And that's okay, because there are a lot of clients out there who have different points of view. And each clinician will mesh with different clients. Some clients are unwilling to say, I'm going to abstain from all mood-altering substances during early recovery. So if they're not willing to say that, you need to be able to find a way to work with them and help them through their early recovery achieve whatever goals they have set for themselves. The BS detection kit. I like this one. If you're in a conference or in a meeting or in a brown bag, people are telling you a bunch of stuff. So how do you tell whether it's good stuff or just stuff? Are the ideas, principles you are hearing clear, or is the reasoning circular? This is an awesome argument, awesome intervention, so I'm telling you about it. And because I'm telling you about it, makes it awesome. Are ethical decisions supported with relevant, valid evidence? You need to use this for your clients because, well, if I'm going to use it for my clients, then it should be in the best interest of my client, beneficence, and above all, do no harm, and fidelity, and all those other things. So I'm thinking, okay, I need to use this with my clients. Does it mesh with my ethical and moral decision making? Well, how do I know unless I've got relevant, valid evidence? Have you used it with the population I serve? Are there special types of training that I need to have prior to engaging in this? What are the risks and benefits? Are there any populations for whom this would be an ineffective or inappropriate treatment? I need to have all that information. Are there any qualifications that may need to be made with a particular ethical claim? For example, in this instance, the client experienced blah, 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 blah. Or due to the circumstances of this case, this was the best choice of intervention. Most of the time that's going to be true. So we need to know what the qualifiers are. Because again, no treatment is the perfect treatment for everybody all the time. We need to examine people and examine situations as individuals. So let's talk about ethical decision making with regard to certain scenarios. Calling the abuse hotline. It sucks. I hate doing it, but we have to. Unfortunately, I don't know a counselor out there that's in practice in agencies or independently who hasn't had to call the abuse hotline at least once. So the question is, how do you do it in a way that most closely matches your ethical promise to your clients to do no harm? Can you involve them in the process? Can you have them call on themselves or make the report themselves while they're in your office? You have to be able to verify that they actually called and get the number and what they actually said. So maybe they can do it in your office. Maybe you need to tell them before you make the call, or let them sit in the office while you make the call. Sometimes, in the interest of the abused person, it is not going to be in the best interest of the victim to let the patient know ahead of time. If the patient is the abuser and you suspect that this could just escalate things. So you have to look at the situation in terms of ethics. What is the best scenario here? Breaching confidentiality to let a parent know that his or her child is in treatment. Sometimes it's necessary, sometimes it's required by law. Many states have laws that allow substance abuse counseling with a juvenile without parental consent. Not all states have that. So you need to know your laws. What states require you to inform the parents of what? Do you need parental permission before even treating the juvenile? warning a person whom you know to be in danger, so you have an identifiable victim in imminent danger of being harmed by a patient. That's Tarasoff 101. You have to inform the patient or the person. And if you can't inform the person, you try to call them, or you don't know their phone number, but you know their name and address, or some way that you can get law enforcement to be able to intervene to protect the identified victim, you have that obligation. Warning the significant other of a person with HIV that he or she is infected. In many states, it's illegal to do this. Ethically, yeah, we want to protect those people. But in many states, it's illegal to inform partners of HIV-positive patients that the patient is HIV positive. So you need to know what your laws are. You need to know what your laws are, and then if you are able to do it, what's the cost to doing it? Is it ethically and morally justified? These are all really tough decisions to make. Okay, so more BS detection. Is the presenter staying on point? If they get off into war stories, they may just not like presenting, or they may not know what they're talking about, so they're just trying to use up time. Does the conference or meeting have a logical sequence? If the person's bouncing all over the place and you're sitting there going, I have no clue what you're talking about, dude. Might be that they don't know what they're talking about and they're just trying to fill time. Again, is there support provided for claims made? They don't need to cite it verbally as they're talking about it, but do they have a bibliographic reference? Do they have a book off of which it was based? Do they have the ability to point to their reference materials? Can you paraphrase the claims and points? If you can't paraphrase them, it means they're not clear. Are alternate ethical conclusions considered and given any weight? If you're looking at an ethical decision, and we've all agreed we've got to meet the legal requirements, but there are multiple courses of action within the ethical realm, does the person consider all, or at least some, of the different alternatives, or is it their way or the highway? Are there points of summary and closure? Talk about something, summarize it, close it up. If not, consider. It doesn't mean it's necessarily BS. It could mean it's a bad presenter, or you're just not jibing and communicating in the same way. But it is a warning flag. And is the argument or information complete? Are you looking at the pros and cons of each decision or each treatment or each situation? It's ideal to have all this, but these are warning signs that you want to look at when you're at a conference to make sure you're not being sold sand in the desert. Evaluate conclusions in research articles, from the news media, from your peers, from your clients, from yourself. Observe and identify the facts, what you know the facts to be. Try to take multiple perspectives to make sure you're not missing any facts if you look at it from different points of view. Form a hypothesis. What do you think's going on? So this is kind of like when you're doing an assessment. You're observing and identifying facts. You're getting the information. Integrated summary, you're forming a hypothesis about how all this is working together to create the perfect storm. You're going to test, experiment, or rule out alternative explanations. Now, when we're talking about treatment, we're not going to use patients like guinea pigs. But we may say, Sam, you tell me all this stuff is going on, and you've got financial stress and stress at work, and your marriage is falling apart. So I'm wondering if any of that has to do with your drinking patterns. Talk to the client. Test your hypothesis. Ask him, well, you tell me you don't have a problem with drinking, and I think that's awesome. So in order to help you get off probation or complete the course requirements, you need to stay clean and sober for 3 months. You think you can do that? Yeah, sure. Okay. So the client has formed the hypothesis. They believe that they don't have a problem and they can stay clean for 3 months without your help. Thank you very much. So we go into it and we try it. If they do fine, then we need to go back and look at our interpretations and go, wonder how I came to that conclusion. If they don't do well, then we need to go back and go, okay, so this might be a little bit more of a problem than you were thinking. What could we do? What are some alternative explanations for why you failed to stay clean and sober? Stress at work. Okay, how do we address that? Refine and retest your explanation or your course of action. And can you support it with relevant, valid evidence? We know, based on these particular studies, or you may even say, based on my clinical experience, what I've seen is people who have sober social support systems tend to do better than those who live in isolation at maintaining sobriety during the early recovery period. So what kind of data are we using? And I've been throwing out a lot of these terms. Virtue ethics. We have our laws, and then we have our virtuous ethics. We want to examine whether we are encouraging our patients to have autonomy or freedom of choice. We give them all the information they need about the different treatment options or about the different possibilities and let them make an informed choice. Non-maleficence, do no harm. Above all, do no harm. So when you look at it, what is the best solution? What is the best possible outcome, and how can I try to support that? Beneficence means contributing to the welfare. So, of course, we don't want to harm our clients, but we want to do more than that. We want to help them achieve their goals and move towards self-actualization, highest quality of life, whatever you want to define it. Fidelity. Are we being loyal and faithful to our clients? Are we telling them the truth? Are we making sure that we're keeping ourselves in check, so when we're in session with them, we're 100% present? Are we keeping our appointments as scheduled? All those things play into loyalty, faithfulness, trust, fidelity. And justice or fairness of treatment. If you have a situation going on, you may want to ask yourself, well, how would you approach this if it were your child? Or would you recommend the same course of treatment to another counselor in the same situation? If the answer is no, then you need to say why. Why am I special that I can do this and I don't think it's appropriate for anybody else? Or why is this situation unique? These are all things you need to look at. Again, above all, do no harm. Encourage your patients to have freedom of choice and autonomy. Empower them. Help them reach their goals, not necessarily yours. Be faithful in your duties. And try to be fair. Another simpler model, which I summarized at the beginning of this presentation. You've got a problem. Identify the problem. Apply the code of ethics. ACA, NBCC, AAMFT, whatever it is, whatever your code of ethics is, apply your code of ethics. Consult with a colleague. Make sure that your perceptions and reality are really on target, or enable yourself to consider alternate interpretations. So identify, apply, consult, generate potential courses of action. there's generally multiple options. I could do this, 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 or this. Consider the pros and cons of all options. Evaluate the selected course of action for ethicalness and legality. I don't know if ethicalness is a word, but it works. So, is it legal? Okay, if it's legal, we can move on. Is it ethical? Yes. How ethical? Which one is the most ethical? And then implement the choice. After it's implemented, go back and continually reevaluate to making sure it is still doing no harm, assisting the client in furthering or improving his or her quality of life, doing what you said you were going to do. How do you know if you're behaving ethically? Well, first key is, have you been honest professionally and personally? Yes. Okay. Now, honest means looking at the picture objectively, not focusing only on the positives. Well, it could have been worse. Well, let's look at what worse could have happened. You just got lucky. So be honest about your skills, about your effectiveness, and about risk management. Always look at what could have gone wrong and try to implement mitigating factors. The more you fine-tune your system, the more ethical your system will really be. Are you acting in the best interest of the client, and or are you obeying all applicable laws? You got to obey the law. You also need to make sure you're acting in the best interest of the client and not just acting in your best interest to cover your own butt. Are you acting without malice or for personal gain? Don't refer somebody to a treatment center or a lab or anywhere else because you've got this quid pro quo relationship going on. If there's personal gain, you really need to look at your motivations. Most places suggest if you're going to make a referral to a client, try to give them 3 options and let them choose from the 3 options. Or refer them back to their insurance company and say, call your insurance company and see who's on your provider panel. Ask yourself if you can justify your actions based on the state of the profession. Based on where your profession is right now, are your actions justified? And the easiest one, would you be embarrassed if somebody found out? Your mentor from college, your mom, your best friend. Would you be embarrassed? Or would you be able to hold your head up proudly and go, yes, I did this? So in summary, ethics before earnings. It's not about personal gain. It's about helping clients achieve their highest quality of life. Always evaluate data. Look at the pros and the cons and the caveats. Consult, consult, consult. Even if you don't think you need to consult, sometimes it's helpful to just consult, just to eliminate any doubt that you have a full range of view of what's going on. And document. Document your consultations. Document interventions that you've used and why. Document any treatment successes and failures. Document what's going on. The only way to prove something happened after the fact in our profession, unfortunately, is if it was written down, it probably happened. If it wasn't written down, then it probably didn't happen. So make sure you document. It also helps prevent faulty memories about what happened or didn't happen. Okay, I hope you enjoyed this presentation, and I will see you at the next convening of all CEUs.